Okay.
So long as here.
Well, thank you for joining us. I'm Mark Larson, Commissioner of the Department of Vermont Health Access, and happy to have you here today for our status report on Vermont Health Connect. Obviously, the big news today is that Vermont Health Connect is open and Vermonters are using it. We have successfully launched the website and the call center is up and running. We are successfully today connected to the Federal Data Hub so that Vermonters can access information from there for their application and verification of identity. Vermont Health Connect is working as we expected on day one. And we think that that's an important milestone because access to quality healthcare has too frequently been a challenge for too many Vermonters. Access to affordable healthcare has too frequently been a challenge for too many Vermonters. And what we know is that Vermont Health Connect, as a new way to purchase health insurance and a new way to be able to compare plans side by side, the ability to access financial support and financial help for those who qualify, is a real important step towards Vermont's healthcare goals. And so today really is a big step in a long journey that doesn't end here today, but obviously we have achieved an important milestone. I want to emphasize that this is also a step in a marathon, not a sprint. We know that we have made progress today. Again, the website, the online marketplace is up and functioning today. We are connected to the Federal Data Hub so that Vermonters can make their plan selection and can enroll can sign up for their account. And generally things have gone very well today. We know that we've also had some challenges, just as we identified that we would have some challenges that we'd have to face along the way, and two that I would identify today. We know that Vermont Health Connect has been slower than we would like it to be. We have identified that issue early on. We started off with a pretty substantial spike when Vermonters came on around 9 a.m., pretty interested to see what Vermont Health Connect would look like. And we've had a consistent, steady stream of users throughout the day. Again, Vermonters are using Vermont Health Connect. We've had about 5,500 unique hits on the website. We had by late morning about 600 calls to the Vermont Health Connect call center specific to Vermont Health Connect questions. So we know that the website has been slower than expected, but that's something that we expect will be improving very rapidly. We also had some challenges with our side-by-side plan comparisons. Today, information about deductibles and out-of-pocket maximums and out-of-pocket expenses is not available in the side-by-side comparison as we would want it to be. The information is available on our website. It is available in summaries of the specific plans. It's available, as was yesterday, in a spreadsheet that provides the information about all the plans. It's also available through our call center if a Vermonter wanted to call up and get the information through the call center. We will bring that information onto Vermont Health Connect very quickly, but that is one thing that was a bump along the road for us today. Frankly, I would go back to the beginning. We knew that implementation of the Affordable Care Act, the federal health care reform, was an important step in Vermont's progress towards a more integrated and universal health system. We know that there was a lot of guessing about whether we would be able to meet the expectations today, and we are very pleased with the start of Vermont Health Connect. We will continue to grow through this day and ultimately be judged by whether Vermonters have health coverage starting January 1st, as is the promise of Vermont Health Connect. So we're very pleased, and I'm happy to have a couple of partners with us today. Lawrence Miller, Secretary of the Agency of Commerce, and Peter Sterling, who represents one of our Navigator organizations that is helping people out in the community. I'd be happy to defer to the two of you for a couple of comments.
Well, I'd just like to say that this is obviously a change that's very important to the small business community and individuals, including a lot of self-employed Vermonters. And we're getting near the time when we start thinking about the annual process of dealing with health insurance, which is never an enjoyable one. It's always a little bit of a process. And I just really want to express my appreciation to you and to the team that's put the effort in to make sure this is available in a timely fashion and ready for when people generally get going on that every year. And we're still in the early part of the season when many of us generally pay attention to it. And so congratulations and thank you.
Thank you very much.
So I am, as Mark said, a navigator. I also work for an organization whose mission is to represent the interests of consumers in this whole healthcare process. And I have to say that I'm pretty darn pleased at where we are here on October 1st as far as consumers having access to the information they need through navigators and other forums. I mean, I feel very confident that by the end of the open enrollment period in March, any Vermonter that needs to know about their responsibilities to enroll and what they're facing as far as costs and different plan options will have that information available to them. So I think where we are on October 1st is just fine. People are able to access the information they need. And I think the resources that are available, I have to say, to me, it's just so broad in scope, especially when we compare it to Catamount Health, which I was also involved in the rollout with, which was very underwhelming, to be honest. It rolled out very slowly. It took Vermonters a long time to understand what their options were, many, many, many months. Whereas I suspect with this exchange, because of the resources through the Navigator program and other areas, Vermonters will know in just a couple months, we'll have really great information. So I'm really pleased.
And so I want to recognize, well, first that it's partly incredible that I'm able to put two sentences together. We have been living in this building for quite some time, and we have some folks, but particularly Lindsay Tucker, Deputy Commissioner of Vermont Health Connect, folks who have been doing tremendous work and deserve a great deal of the credit of our success today. I know that we are not the only state to be trying to implement the Federal Affordable Care Act, and we feel, I think, a little bit of a bond with some of our other state-based exchanges that have launched today, and I think it's an important event, not just for Vermont, but really for the entire country to be moving forward in some really important reforms of our healthcare system. So we're pleased with the progress we made today. It's just the beginning. We know that we have a lot of work left to do, but we are very pleased with the way day one has gone. Be happy to answer questions if you have them.
How much of those 5,500 came in the first hour?
I frankly don't know, but I do know that there was a fairly substantial spike of folks waiting right at 9 o'clock. Another interesting thing that we did notice is that a lot of Vermonters did spend some time on the website. So what we expect is that people aren't going to rush out to purchase coverage on day one. I think there'll be a lot of shopping and a lot of comparison that goes on for the first period of time, and then people will eventually get around to making their plan selection. So we saw a lot of people come on first thing to take a look, and what we found during the day is that a fair number of people spent some time on the website checking it out, and that's gratifying.
Do you have numbers on purchase orders?
I don't have numbers about that today, no.
Are you saying that the speed, the sluggishness, or the difficulty getting in at all was the result of, essentially, did they not crash the system, but was it because there were so many that the site was so slow?
No, I think it was more about making sure that we have all of our servers appropriately calibrated together and working efficiently. And so it is really a technological problem that we're working our way through. Certainly not something that we can't respond to quickly, and I fully expect that problem will not be around for very long.
Do you have any idea how many Vermonters have actually been able to enroll in a plan?
Yeah, as we have talked about, Vermonters who pick their plans in October would be invoiced for payment in November. For our records, enrollment requires the submission of the payment and then that information to be transferred over to the insurance company. So we know that a lot of Vermonters have come on and started to set up their account on Vermont Health Connect, which is really the first part of the process. That, again, matches what we would fully expect, is that people aren't really going out to purchase today. What they're doing is they're taking a look at what the resource of Vermont Health Connect is all about, what kind of information is there, and how they can access it to help support their decision making.
So, in terms of registering, any idea how many people have been able to actually register?
I don't have it.
Do you know why? I spent about 3 hours off and on this morning trying to register. Any idea?
So you drove up our average time on the website.
Any idea why I wasn't able to?
Why you?
I wasn't able to complete the registration form.
I know that we've had challenges with the speed, and that has been a part of the challenge for Vermonters. Our understanding is that those things are connected. Again, we went into day one knowing that we would face some challenges, but not necessarily knowing exactly what they might be. And we appreciate that those are some areas where we can improve going into day two.
And can I just add, just to back up what Mark has been saying, in the last just 2 weeks alone, I've spoken to hundreds of people, many small business owners, probably a couple dozen, who expressed interest in Vermont Health Connect, and no one has said they want to enroll right in the beginning of October. So I really do want to reinforce that I don't think this is actually going to, even if the computer is moving a little slower, or there is not every piece of information available right today, I don't think it's going to impact a consumer's ability to get the healthcare plan they want in a timely way. I mean, I've asked people if they are interested in enrolling, and they are all, like Mark said, looking at the options. I mean, they're looking at, this is half the plan, so they're looking at this and then chewing it over, and they're going to take time. Even the small business owners who really have an incentive to get this off their plate early are still not able to process this fast enough to enroll this first week. So again, I don't think the consumer's experience at all is being harmed by not being able to purchase insurance here on day one.
But if you can't register, you can't actually compare the plans side by side in a user-friendly format, correct? Or is there a way to do
You
that?
can anonymously browse without
Yeah.
setting up an account. Yes.
Are there any concerns that the website and the servers are having some trouble just handling people looking at it right now, that in a month from now, that some of the fears that people have had in terms of the ability to purchase these plans might actually be founded?
No, I think our systems will be fully capable of serving the needs of Vermonters. We've built a system that I think is very, very capable of people getting on there, being able to compare plans, being able to make their selections, and then being able to complete their purchase. Going off Peter's comment, one of the things in our education and outreach efforts is reminding Vermonters that in order to have coverage in January, that they have to make their plan selection and pay their premium by early December. What we expect is not so much a rush in the door on the first day, but really having to remind Vermonters that they need to make that payment in early December to have their coverage effective in January. So we'll continue to make sure that Vermonters are aware of that schedule, because we want people to make their selection in time for having coverage in January.
In terms of the website, though, do you have a number for what the capacity is? How many individual users can be on there at the same time?
I'm sure that there is some answer to that. I don't know it, but it is a substantial number, and if we ever got to the point of reaching some form of capacity, we could expand the amount of that capacity to be able to serve Vermonters. I'm not concerned about the capacity of Vermont Health Connect to serve people.
And in terms of what happened this morning, I'm sure you did a lot of testing of the system
Yeah.
beforehand. Did you not do enough, or I mean, how do you? If it looked good, all systems go as of say yesterday or last week or whatever, and then you actually go live and it doesn't, you kind of ask yourself, well, what happened?
I mean, we did a lot of testing, but we were doing testing in a closed system before it was plugged in, frankly, last night to its final technological terms. All the pieces came together last night for its final launch this morning. Obviously, we had done some testing to make sure that you could run a lot of applications through there at the same time. So I think this is a challenge in a long effort, but one that will not be an issue long term.
Fairly consistent with any large IT implementation, I think is the short answer.
And
You run into that at the HT of Commerce too, have you, Lauren?
Yeah. In Danforth and at Otter Creek and everywhere I've done a large-scale implementation.
Don't you think the stakes of this are a little bit higher? You have roughly 100,000 people who are required to actually get their health insurance coverage from this, and right now it's not working.
This is the opening of a long window under which people have to make decisions. As I said, this isn't even really when most businesses have begin to think about this in a normal year. So the anticipation of having a go-live date and being able to have everything accomplished in a timely fashion, these are normal expectations with any significant IT implementation. And I would say that when you deal with any project of this scope, businesses are used to having regular range of issues to resolve when you put it out in the world.
Andrew, also to your point, having interacted with a lot of low-income people and helping them with Catamount Health, and particularly VHAP and Medicaid, if the people who I felt were coming to the exchange right now, October 1 or 2, are really low income, and this might be the one time they're willing to make a call because they're busy and they're frustrated and they don't want to deal with this again, I would be really, really concerned. But the fact is, the people that I am seeing that are interacting with the exchange now, because they're telling me their income, first of all, because they need help. They're higher income people, they're small businesses. These are people who, my experience says, will come back. Even if the first chance isn't the perfect solution to their needs, they are going to come back and try again. It's not like a low income person who I feel, if you can get them on the line or get them standing in front of you, fill out a form, you've got to bring them in at that time. You might never see that kind of person again.
And I might just say that we've battled expectations for quite some time with Vermont Health Connect. There's been plenty who have been saying for a while that we'd never be able to get it launched on October 1st. Even over this weekend, there's been a lot of comments about what we can and can't do. I think, frankly, the fact that we are up today and the challenge that we're facing is that the website is slow is frankly come a long way from just what the conversation was in the past few days.
Peter, can you talk about in terms of people that you're guiding through today, what questions do they have, what concerns do they have, what problems are they running into?
Really, the thing I'm hearing the most in the last 2 days is the government shutdown in DC going to affect the exchange. I heard that 4 times today sitting in front of the Montpelier Department of Motor Vehicles. And then the other question I actually hear a lot is, will this affect my Medicare? Of course, we can answer that. But after that, mostly the questions people have is our cost. How much am I going to pay to see a doctor? How much is it going to cost me? That kind of thing. And I will say what's been interesting so far is people have raised awareness of the individual mandate, which I didn't think very many people would know about, but apparently many people do because they asked me about it.
Mark, what if any clouds are created on the horizon by the government shutdown?
So because healthcare is an essential vital service, the funding for the Affordable Care Act and the resources of the federal government that we rely on, we can expect will be there. And so in terms of operation of Vermont Health Connect, the federal government shutdown will not impact our operation moving forward.
And what if the House GOP successfully gets defunding of Obamacare tied to an agreement? Not that it seems especially likely to happen, but I mean, in that circumstance, would that have an effect?
I know that there's a lot of politics going on about the Affordable Care Act, and there are many people who continue to wish for it not to be implemented. I think we've hit a point today with the implementation of an important part of the Affordable Care Act. I'm frankly more worried about the speed of our website than I am about the funding for the Affordable Care Act going away.
Were you, is it fair to say you were surprised at the traffic that you saw this morning, Mark? And what's so difficult about making this work properly, to those who've never done this?
similar to, frankly, something like Amazon.com or Orbitz or Cars.com. The complication of Vermont Health Connect is that it's a marketplace that facilitates transactions with a lot of different sources of information, and making sure that all that information is flowing accurately and securely and in real time includes a lot of integration, and it includes making sure that we have the technological capacity to handle a lot of information. That's just a complicated system, and it will take some tweaking. But this is really a challenge that, of all the challenges that we could have had today, we wish we had none, but we'll work our way through this one quickly.
Will Vermont Health Connect be running 24/7? Will you be
No.
able to register? Okay.
No, actually the Federal Data Hub is scheduled to go down every evening for maintenance. And so we will also go down every evening because of the important connection. So our schedule right now is that on a regular basis, Vermont Health Connect will go offline from 12 a.m. to 6 a.m. and then come back from 6 a.m. to 12.
And will it just look like it did this morning at, say, 8 a.m. Vermont Health Connect?
There'll be a sort of a face page that will come up.
And, sorry, I just want to make sure I'm clear on this. In terms of people who have actually registered, right now, you're not sure if anyone's actually been able to register. Is that correct?
We know that people have established accounts.
Okay.
But you don't know the number of accounts.
I don't, I'm sorry.
Do you have any idea how common paper filing has been and